So we do. We have a couple of questions. First, for Dr. Fossler, are there any plans upcoming for a NOMS dairy study on antimicrobial use?
Not at this time for a specific study. We will be planning a dairy study in the next few years.
Okay. Good. Rory, you mentioned mortality as the outcome of arbitrary Dutch antibiotic use metrics. Can you provide some discussion around the outcome for that related to humans? Any correlation or discussion or commentary that you want to provide there?
Yeah, not really. No, I mean, the mortality in the calves went up because they were just restricted on the amount of antimicrobials they could use. The long-term impact that I've read in the Netherlands was that they are now finding less resistant bacteria. But I'm not sufficiently knowledgeable about that to really tell you much. I've read that as an anecdote. Just take it as an anecdote. The mortality, I know for sure.
Megin, there's questions about the puppy issue. Dog to dog, then dog to human, human to human, human to dog. This, as we start talking about resistance genes and this never-ending, how big, how real is that risk?
Well, I think in this particular instance, we saw that the antimicrobial resistant bug that was found in the puppies, the Campylobacter, was also found in the people. And we did get some questions about, is this going from people to the puppies? And in that case, we looked back at the NARMS database for human Campylobacter isolates, and the number of multi-drug resistant Campylobacter organisms since the inception of NARMS prior to the outbreak, so this is in humans, 0.03%. So that did not seem to indicate that this is something that emerged in humans. Furthermore, if you look at that resistance profile versus the antimicrobials that had been used, what was found is the resistance profile matched up very, very well with the type of antimicrobials that were being used. And so essentially, in terms of the practice, many of these puppies were being fed antimicrobials similar to what we might do with a particular large animal species because they were being raised as herd animals. So I think we saw in this particular outbreak a pretty clear example of how that happened. Now, in terms of the genes that conferred resistance in Campylobacter and where that might show up in the future, I can only speculate, but I don't think it would be wise to do so because I think it might just be pretty scary. So we're monitoring the situation very, very closely, and we'll report out any additional information.
I think we have a question in the room.
Yeah, Megin, a follow-up. I took a picture of your slide with the susceptibilities and zoomed in so I could see the drugs. I got them all except FLN, the one that's yellow that's showing susceptible. What drug was that?
I'd have to go back and look specifically. And I'm looking at Danielle. FLN on the NARMS panel. That one's a different one. I know that in the instance that we had a human infection, human patient hospitalized with the multi-drug resistant strain of Campylobacter, one of the things that they were using to treat was meropenem, because it was basically the last thing on the shelf that they could reach for. But I'm happy to get that information and report back.
Yep, thank you.
I have a question on Slido to Dr. Stroud relative to MRSA in plants. Can you provide a little bit of discussion, and how come we never hear about that particular issue?
Really quick update, fluorophenicol. It's not FLN, it's FFN.
Okay, so it was
Thank you.
Sorry, repeat.
The question was relative to MRSA in plants. And why are we not paying attention to that? And why does it never seemingly get attention? And can you provide any commentary on that? Or
Well, we need to. We need plant people here. I'm trying to get plant people involved in the One Health conversation, and there are plant people who really get it about this One Health conversation and realize that they need to be at the table. I have no idea why we're not talking about MRSA and plants. I don't know enough about it myself to really comment on it, but it's that's my challenge to us, is to include the plant people in these conversations. How are you going to feed these pigs and poultry and beef if you don't have really healthy crops and healthy soils to produce them?
Lucas.
So, Rory, very interesting presentation. So you talked about trying to bring up the bottom side of the production, and if you look at the developed world, right, there are the most number of cattle there. So how do you implement stewardship in those developed countries? Because probably there is where sanitation is the worst, and where overuse of antibiotics is more of a problem.
Yeah, and indiscriminate use of.
Actually, about 3 years ago, Katie had some horticulturists come and talk about fruit and spraying them with streptomycin, and our infectious disease physician said he was very jealous because he couldn't get streptomycin for his patients. So we have brought those people in the past. But I can tell you some of the things that we have learned over the years, and I'm a pharmacist, but I'm an infectious disease pharmacist. And when we were taking samples, we were culturing horses that had staph. So when we did routine culture and sent them to the micro lab, we have a great micro lab, they were just staph. But when our microbiologists actually looked at the PCR, they were MRSA. So what we found, and they have learned that in human medicine, is that by the time you take that sample and get it processed to the lab, the biofilm goes away. And so the biofilm protects that MRSA. So we also have been treating inappropriately because our samples are not accurate. So a lot of the hospitals are going into PCR with these small kits for diagnostics. And we're seeing that in salmonella as well. And we also looked at salmonella in between horses and cattle, and with different serotypes, and it is the identical salmonella. So I think we really are going to have to do some identification along with this too, because we're treating maybe with the wrong antibiotics because we're not preserving the sample.
Yeah, I was going to try and respond to that, but I got some feedback, so I stopped.
Okay.
And it's going to happen again. Can you stop it happening? Okay. How about this? Right, so you're right, of course. The challenge in those countries is that, for a start, you may have very limited access to veterinary services, and therefore you also have little control on the way that antimicrobials are used, so they're used indiscriminately. I've been in pharmacies in southern Ethiopia where they had animal, veterinary and human antimicrobials on the same shelf with labels in English where nobody could read English. They had absolutely no idea what they were supposed to be doing with these. Luckily, they were stored at 35 degrees, so they're probably totally ineffective anyway. But, yeah, it's a big challenge. And one of the routes to working in those countries is through the processors. Certainly, if you've got any kind of an export market and you've got processors, they are usually the best way to access producers and to work on extension. And also, rather than veterinary services, which is probably an unrealistic dream in, for example, much of Africa, we can at least work on paraveterinary services. I ran a paraveterinary program in Afghanistan where we trained paravets for 6 months, and we were in control of the supply chain for all of the vaccines and the medicines that they used in Afghanistan. So we could at least improve things. I'm not saying it was perfect, but it was better than what would have been the case if we'd have just left things to themselves. It's a huge challenge and it needs a lot of investment.
So thank you very, very much. It was an absolutely wonderful, wonderful panel. Thank you. First time I think we've had a mic drop at the NIAA meeting. So thank you very much.